Hi guys, I'm Tyler from Maple City Physical Therapy. We're here to talk to you about spine pain today. Also, we have Jen and Brett who are also working at Maple City, and they're going to talk about different aspects of spine pain as well. Jen, you can say hi.
Hi.
Hey
Brett.
guys.
So I'm going to start, and they're going to actually come out of the discussion. So I will start today about general statistics of the spine, a little bit of anatomy, and also kind of how we as physical therapists here treat under the McKenzie method. You may have heard of that method before. We'll talk a little bit about that as well. Just to start, it's interesting to note that at least 50% of all people at some point in their life will display some sort of pain in the neck and or the back. So 50% of people will have neck pain, and another 50% at least will have low back pain. So if you do the math, that's almost 100% of people are going to experience at least one or the other. So that is pretty significant to note. When you're talking about the spine itself, I have a model here. And this is a fair preview of how the spine looks. You have different curves of the spine. Okay, so we're looking at a low back view here. And we have an inward curve of the spine of the low back, the mid back, also called the thoracic spine. So the low back is called your lumbar spine, the mid back is called the thoracic spine, and your neck is called the cervical spine. The mid back has an outward curve, okay, and the neck has an inward curve that supports your head. So we're going to talk both today about the neck and the low back. It's important to know some of the outstanding pieces of the anatomy. So you have your vertebrae, which is the big bony structures. In between you have the annular ring or the cartilage. And in this is a fluid-like component called the disc. And you think of it almost like the jelly inside of a jelly donut. With good distribution, you're keeping your inward curve, your natural inward curve. It maintains pretty good even distribution of pressure on the cartilage on the disc itself. It's when we start applying uneven pressure where we sort of get in trouble and where complications can arise. But your spinal cord will run behind your vertebrae. And from the spinal cord, we have a canal where it runs. It's called the foramen, the spinal foramen. And you have these little nerve roots that come out, okay, and they, down low, they can innervate down into even your legs. You get two big nerves. One of them you've probably heard of is the sciatic nerve, and it runs down from your spine to all the way to your toes. So important to note that, you have it on both sides, and there can be many reasons why a nerve gets pinched, or it could be, obviously you see here in this model, it shows a herniated disc. So that can be one cause of spine pain. And this is called your spinous process, the lamina. There are different kinds of injuries that you can get. One is like a Scotty dog fracture, where you fracture the spine in that location. But I would say the most common types of spine pain we see, and with the McKenzie method, we classify it so that we know better how to treat it. The number one source of pain that we see as physical therapists and in general the spine is like mechanical obstruction, where maybe positionally or the frequency of bending forward typically, and mostly if you're having a mechanical obstruction, almost 80% or just about 80% of all obstruction occurs because of poor positioning into flexion. So that means, we're not maintaining the inward curve. It could be that we're slouching, sitting on our tailbone, okay, and that low back flattens itself. Now when you flatten, you can see how much pressure now is anteriorly, this is the front of the spine, how much pressure it can put on the cartilage itself, and almost like you're crimping down that front side of that donut, and that jelly wants to push back a little bit. So if you're slouching all day, what will happen is that material will migrate towards the back where the nerves run, and it could be pinching on a nerve root, okay? Um, but ultimately, we see the majority of mechanical obstruction comes from positional or frequency of flexion. It could be maybe you have a sitting job during the day at a desk, and the same thing with the neck too, because what happens when we flex the low back, the head comes forward, it protrudes, and it puts more pressure on the very base of the neck itself. Or if you're looking at your phone all day, you put your neck into flexion, you lose that curve by looking down maybe at a computer or at your phone all day. But also, it's important to note that it could be, maybe you have a lifting job where you're bending over at the waist all, for a large majority of the day. You're outside gardening and you're bent over at the waist. And the average statistic is that almost 6 hours of the day you're spent in flexion. You're spent bent over. And less than 25 minutes of the day you are in extension. So that huge disparity in time of position in your back can equate to pain down the road. It might not be that immediate time, but you do it for 10, 20, 30 years, and then you're at a greater risk of developing some sort of obstructional problem. But that's one of the categories we tend to see. It is the highest rate that we see in the clinic, but there are other things such as adaptively shortened tissue. There is pure postural syndrome, meaning that once you sit well, the pain goes away, and as soon as you slouch, you put tension on the structures, and then they start to hurt again. So that is very, very rare. But and we'll also see post-surgery and stenosis presentation. Stenosis you've probably heard of. It's narrowing of the canals. So the canals you can see where the foramen they're called, they can become smaller, or bone growth over time can make it smaller. So those kinds of classifications are treated differently, and it's important that we're able to identify it. The only other piece with the anatomy I wanted to make mention of is that when you have symptoms, sometimes it comes from your back and sometimes can refer to different areas. You have your neck. Your neck can refer to your shoulder blade. It can refer down to your arm and even into your hands. It can create pain. It can cause numbness, tingling. It can give you headaches as well. Your mid-back itself can refer pain into the ribs, and even can make it hard to breathe at times. I've seen it where it causes nausea as well. And your low back can cause sciatic pain or referred pain into the buttock, into the leg, even all the way into the calf, into the foot. And I think it's important to know that you can have back pain, you can have neck pain without those symptoms, or vice versa. You can have pain in the calf without back pain. So I think it's important to know, especially if there's variability of symptoms, that's the number one factor that you'll see, that maybe it's not a calf strain or cramping in the calf. It could be related to the back, especially if you're sitting and all of a sudden you're promoting that frequency of flexion, right, where it's going down to your calf, into your foot, and you're not really doing anything. And it goes away if you stand up and walk. That can be really a telltale sign that there might be something wrong with the back or the nerve. Maybe there's a pinched nerve that should be addressed. And as far as physical therapists go, moving into the evaluation process, we do look for those classifications to start. And like I said before, the most common injury that we see is based on that mechanical obstruction, that material that has moved out of place, pinching on a nerve. That is probably the number one that we see and are able to treat, and they get better very, very fast because we're just trying to move that material off the nerve. We have to make sure that we're identifying a few things. We're making sure that we have the right direction of pressure. So 80% of the time it is extension, but sometimes, there are people that need flexion or lateral movements. The other piece of it is, are we applying enough force? So if we're trying to give someone extension, we might start lying flat on a table. Okay, I'm going to show you on the floor here. So usually the most preliminary piece of extension that we do is lying flat, okay? That brings us into a neutral position, and sometimes people with leg pain, that's where they have to start, or people with pretty intense pain in the back or very stiff, they have to start there. The next progression is we typically go up on our elbows, and you don't want to do this too quick, especially if you're just starting. You want to make sure you get a good 3, 4, 5 minutes. Important that with extension that you are relaxing. You're not squeezing, not letting anything move. Let gravity be your friend in extension. Your body probably doesn't do this a lot during the day. It's important to note that you need to relax and allow it that timepiece to get into place a little more. But ultimately, by the end of the treatment, what we usually have people do is take their back into end range extension. I tell people end range is where the magic happens. It's where you get the most stability of symptoms. And that's where we take and make sure we get our back into end range and relax. You can see how my hips are still on the floor, but I'm keeping my elbows locked out. And I'm still relaxed, and I come back down using my arms. And you can do anywhere, you tell people about 10 repetitions is ideal to start. But, it all depends on what symptoms you're experiencing. It's important to note that if you're having leg pain and the leg pain gets worse, you don't want to keep building that force into extension. Even though, most people do get better with extension, some people need the lower levels of extension before they can go to end range, which is that arch all the way back, almost like that downward dog approach. So it's important to note that, if you try this at home and you're not having, maybe the leg is getting worse, that's a telltale sign that you need to make sure that maybe you're contacting your doctor about that, or physical therapist, maybe getting an evaluation. But for a lot of people, just starting extension can help reduce pain, especially in the back, because your body needs that extension to move the material back into place. So for physical therapy, typically I'll see people for somewhere around 8 to 10 sessions. The first 4 sessions or so is trying to reduce pain, trying to manage it so that you are maintaining your inward curve as much as you can. And I would say going further down the road, once pain is more manageable, the material's in place, we then try to stabilize around the spine. We try to strengthen the legs so that you can use your legs, you can use your core to do certain functional activities throughout the day, lifting, bending, not bending over at the waist to lift. When you're sitting, you're able to sit up longer without having to slouch. So those kinds of things, so that down the road, you don't have these symptoms again. So that's kind of how we see it. I will let Jen speak next about, she's going to talk about prevention and some exercises, other exercises that we do in the clinic. But we'll wrap up at the end so we can make a few more comments. Jen, you're up.
Okay. So today I want to just talk about positioning. So like Tyler had mentioned, a lot of people spend most of their day or most of their time in a forward flexed or slouched position. A lot of people end up, when they're sitting on their couches, they end up bringing their feet up and kind of crunching themselves up into like little balls. So the best position really is, for your low back itself, is if you can lie flat, like Tyler had shown, either lying on your stomach, flat. If you're watching TV and you can lie, up on your elbows, that'll help reverse some of that, some of the forward flexion that you do throughout the day. And then if you do have to sit for long periods of time, it's all about sitting tall and using a lumbar roll or a towel roll, kind of tucking it in to your low back. So you want to sit back all the way in your chair, kind of put that in right at the top of your buttock into that curvature of your back, and then sitting back so it kind of holds you up tall. If you're in standing, you want to try to avoid being slumped over or slouched over. You want to stand tall, keep those shoulders back. For your neck, If you're lying down, you want to try to use either one pillow or you want to lay in your back using one pillow or no pillows at all. The more pillows you have, the more forward flex that you're going to bring your neck. And then obviously adjusting like your computer screens, making sure they're upright, not looking down at your cell phones all day. If you're going to be reading a book or looking at your cell phones, you want to hold it up high, kind of adjust it so that you can look straight at it, using your eyes to look down versus trying to use your head to look down all day long. Exercises that we do that you could do throughout the day as well is, if you do have a sitting job and you are sitting all day long, is just standing every so often and bending backwards, just to try to reverse some of that forward flexion that you do throughout the day. Some shoulder rolls, some shoulder squeezes, some chin tucks to keep your neck back, just to kind of reverse all that forwardness that we do. And then some body mechanics, such as like lifting. You want to try to get things in as close as you can. If you're lifting, say, a crate or something from the floor, grocery bags or anything like that, you want to try to lunge, as well as, getting it in as close as you can. Lift it to your body and then using your legs. So squatting and lunging are very important for exercises to have strong legs. Step ups is another one that you can do to strengthen your legs. Making sure, a lot of times when people have low back pain, they also have hamstring tightness. So stretching out your hamstring, stretching out your quads and your calves, and having good, strong core muscles to help as you're sitting, and it'll help reverse all the slouching that you do throughout the day. When gardening or sorry, when gardening, riding your lawnmower, things like that, you want to really try to make sure that you have good posture. When vacuuming, you want to try not reaching out and twisting and turning. You want to try to use your legs to move the vacuum around versus using, your arms and your waist. When doing your dishes or getting in and out of a dishwasher, if you're hand washing dishes, bring them up out of the sink so that you're not forward and kind of bent over. Bring them up out of the sink and wash them. If you're getting out of the bottom of your dishwashers, try to squat down, pick everything up, put it to the counter, stand up, and then take it from the counter to your upper cupboards. Sitting in your car, a good way to make sure that you have good posture throughout your travels is to get yourself up nice and tall to begin with, and adjust your mirrors to that upright position, so that when you're driving along and all of a sudden you look up and your mirrors aren't correct anymore, that means that you might be slouching. So then recorrect, readjust, and be able to have good position throughout the whole time that you're traveling. At stop signs or stoplights, readjust yourself. But people don't realize it. But as you're driving along, all of a sudden you're bending forward or you're hunched forward, and next thing you know, you're driving along in this position versus being upright and more into this type of position. So it's just all about reversing. So getting out of being forward and out of having that forward flexion and, looking down all the time. Get up tall, get those shoulders back, and just try to stay upright. So Brett's gonna talk about athletes and some of the injuries and impacts that they have. Turn it over to Brett.
All right, guys. So I just wanted to touch quickly about how back and neck pain can vary slightly in the athlete population. So a lot of times when we see athletes with back pain, spine pain, it can be more related to direct impact or a trauma during their competition. So For example, you're thinking a football player who gets tackled, takes a helmet to the back, a blow to the back. Maybe a basketball player goes up for a rebound, they're undercut, they land flat on the floor on their back. So these are more of one-time traumatic events rather than these repetitive movements, repetitive positions. So the treatment can vary slightly. It is important to know, a lot of these athletes that come in, it can be mechanical in nature. The same thing Tyler's talking about with other populations. Sometimes it is, we give you the stretching and the proper directions and things clear up really quick. Other times it's more of just that traumatic impact causes strain to your muscles and ligaments and things surrounding the spine. So the treatment's got to go a little more towards, at first, calming things down. So getting those muscles to relax with some deep tissue massage, some active stretching. We have a newbie neurobioelectric stimulator, can help kind of reset those muscles that are in spasm or irritated. Once we calm things back down, we'd focus more on some weightlifting, some core training, and then adding in some of that postural stability type work that Tyler and Jen had talked about a lot as well. So a little different in how it usually presents and how we treat it, but I think it does always kind of have the same ideas behind it. You got to calm the area down, stretch in the proper direction, do some core strength, some weightlifting, some functional kind of movements, as well as for athletes, we're going to get you back into doing your sport specific movement. So if you're a golfer, baseball player, whatever you might do, we can help train you to do those activities more efficiently and better as well, to take pressure off your back with those. Couple things to think about for athletes, kids in school or college, is definitely, as Tyler and Jen had talked about, is you're sitting at school for 6 hours a day, you're at a desk. So if you're kind of in that forward slouch position or, slumped all day long, you are putting uneven forces on your spine. Then school's out, you want to try to run right out to practice. Your spine is just not going to, necessarily be ready to do that. So make sure throughout your day, you're sitting upright at school, you're trying to change positions, just being aware of your posture. And then after school, make sure you get a good warm up in, dynamic warm up. So you're stretching out your muscles, you're stretching out your spine before doing any high level task. And another important thing is try to participate in strength programs at your school. So a lot of times weightlifting classes are offered through gym class. They're offered through your coach. Some schools, have an athletic trainer that can do weightlifting programs after school. So that's another huge way to try to prevent or reduce the risk of any of these type of spine pain type things would be some strength programs as well. So that's pretty much how the athletes would present. I'll do, kind of a quick wrap up here, then I'll toss it back over to Jen and Tyler to finish. But the biggest thing is if you are an athlete and you're dealing with like back pain or spine issues, try to seek some PT. A lot of times younger kids or athletes think they'll just brush it off, it'll get better, it'll go away. But a skilled PT, we can figure out what's wrong with you very quick, and we can give you some exercises, some treatment to get you back on the field quicker, take care of your back pain probably a lot quicker than if you just brushed it off, as well as get you performing better. So don't put it off. If you do have any of these issues, try to seek a PT. Other than that, I'll toss it over to Jen and Tyler to finish up.
Okay, so to wrap up, I would say kind of like what Brett said, to make sure that you don't wait. A lot of people are like, oh, I don't have time, and they wait and they wait, and it just gets worse. And so the possibility of it being worse, sometimes it takes longer. So the best investment that you can do for yourself, you say you don't have time, you need to make time for yourself. So I'm going to turn it over to Tyler.
Yep, and I have a lumbar roll right here, just real quick. I wanted to show you what we were talking about, trying to maintain that inward curve. So, staying away from the softer furniture, a good idea at home for right now. So making sure that you sit all the way back and putting it, right against your low back, okay? And that's gonna help avoid the frequency of the flexion. So just to wrap up, make sure that you are not, if you're not able to identify, well, geez, I have pain in my leg, is it something where, it is coming from the back? If you're unsure, you shouldn't wait, like Jen said. Make sure you get the care, because there's evidence to suggest 9 weeks of constant pain in the leg or the arm that's coming from the neck or the low back, you're at risk for developing permanency of the condition. So making sure that, you're safe and sorry, right? Come in and get checked out. We do the McKenzie method here, but there are different kinds of ways that people treat it as well. So it doesn't, our philosophy is do no worse, do no harm to the patient. So you shouldn't be leaving here feeling like, well, geez, I definitely feel worse. And that's not how we treat the back. It's, you hear of PT that maybe you get increased pain to start. The back should be, better and better and better each time. So I just wanted to thank you guys for taking the time to listen to us. Any questions, feel free to contact us at Maple City Physical Therapy. Number is 324-9344. Thanks for your time.